We're back with two key figures in Mercy's leadership, President and CEO, Dr. David Maine, and Executive Chair of the Board, Sister Helen Amos. As viewers know, one regular feature of our program is a sort of show and tell, where guests bring something, some item, could be a book, could be a photograph, we don't know, but it's important to them in some way, symbolic of who they are and what they're about. Sister Helen, we'll start with you. What did you bring along with you today?
Oh, I brought a picture of Walter Sondheim, a long-time Mercy trustee, now deceased. But when I say long time, I mean he joined the board in 1970. And with the exception of a few years, he took a little hiatus at a time when he was serving on the Health Services Cost Review Commission. But then he came back on the board and was very active, very thoughtful contributor to the board's work. Right up until the time he died, and he died here at Mercy. So I brought his picture as a reminder of all the wonderful trustees that we have had over the years and the trustees we have now. My relationships with them mean so much to me. They teach me, they stretch me, and we owe them a lot. But Walter was a great example.
Yeah, I remember.
Do you remember him?
Oh, I do remember him. You might remember, I'm going back to 2001 when we did a video with you called Sister Helen Excellence by Design for the Arthritis Foundation event. And I remember that event quite specifically because it took place on September 12th, 2001. And there was a lot of talk at the time, should this event be stopped? But they said, no, that's what the enemy would want. We're going to go forward. And Mr. Sondheim was there, as well as of course, the late William Donald Schaefer. And I remember they did quite a little sort of Abbott and Costello routine.
That's right.
And it was well received by the audience, and as were you. And it was a great moment for Mercy. And of course, Mr. Sondheim and all his work.
You want to hear from Sister Helen?
Just a minute. I was just going to commend you by saying you always tell me what a wonderful lady that is, how smart she is, and what an inspiration she is to you.
Now, you're not reading from the script, though.
Now, here I am. Well, Walter, other than Henry Rosenberg, I think we're the only men on the program this evening.
Yes, it says here. And I think that it's about time they turned the podium over to two young fellows like us.
Well, it's great to have this opportunity to honor someone who is a great personal friend to you, Walter.
Oh, are we honoring you tonight?
Oh.
Seriously, it's a great pleasure to honor Sister Helen Amos. I've known her for a long time, and I'm very proud to have served on her board of directors for many, many years.
And we're blessed to have someone like Sister Helen. In her 10 years at Mercy Center, she has turned it into a jewel of Baltimore's health community. Sister has created a role for Mercy as one of the top in women's health care and a backbone of outreach to the city. And this isn't in there, but I remember the time when I was mayor. I was so worried that maybe Mercy might leave. And that would have been a terrible blow to the city of Baltimore, because this hospital is the downtown hospital where people in the offices and I now get back. Sister Helen has also had the revitalization of one of the treasures, and I think this is great, Preston Gardens on St. Paul Street. Have you looked at that recently, Walter?
It really is. It's beautiful. She's done a wonderful job there.
What's there? And more recently, she opened Mercy's retirement living complex at Stella Maris.
So yes, I didn't know him personally, but it was nice to see him up there speaking, and he was interviewed for the video, as I recall. I mean, we'll have to find that video.
Yeah, we should.
It's been 21 years. I can't believe it's been that long since we did that. Dr. Maine, what have you got for us?
Well, Dan, you've been to my office before. I've had several offices, and I have a number of books in my office. Some big medical books, finance books, leadership books, historical books. But tucked in there is this book. that very few people see. And this is a first grade workbook. My kids are quite a bit older now, 15 and 13, and they were at my office all the time, doing their homework and learning and following me around. And you know, I brought this mostly because it's a kind of warm reminder to me about a very precious time, but almost the very best of the world, of everything, at least in my life. And so it sits there tucked in with all these other books, and I glance at it occasionally, and then occasionally someone picks up on it and says, "Is that a first grade workbook?" and honestly, it brings me a little bit of joy to see it there. So it goes with me wherever I am in terms of my offices here at Mercy. And so I've been here 16 years, and when you're in next time, you can find it because it's tucked in there.
Well, I know how important family is to you. I've seen some of the photographs, and I follow you on Facebook, and I see the travels that you do with your kids and your wife and your family. You know, it's a little bit easier to bring the book in than bring the whole family in, but you know, that I
My
think
kids would love it.
maybe next time, you know. What challenges are we facing here at Mercy? What do you think both of you think the biggest challenge Mercy has faced in the time that you've been here?
Well, I think for any institution or organization, one of the most vulnerable times is when there's a change in leadership. So in my time here, twice we have successfully executed on a transition of leadership. When Tom Mullen succeeded me as the CEO, and then just 2 years ago when Dr. Maine succeeded Tom Mullen. And I want to cite, our trustees. They put a lot of effort into the process of discerning who was the right next leader and making sure that we were prepared to invest in the transition in a way that we wouldn't really miss a beat as far as the work that we do and the fidelity to our mission, doesn't lapse in the course of a very, very significant, the most significant transition that any organization goes through.
Dr. Maine, I know you haven't been president for too long, but you've seen, I can think of one pretty significant challenge that you've had to face here. What do you think I'm talking about?
Well, you certainly don't. You don't want it to go this way, and it was just shortly after I was named as president and CEO that the pandemic began. But with the challenges that came out of the pandemic, I think we just saw the very best of our organization, the best of the Mercy family, this incredible commitment to caring for each other, for caring for our community, to ensuring access and maintaining the highest quality. And it's a remarkable time in our storied history, and there'll be others. But it really, for me, I think, compressed a lot of lessons into a very short period of time. And I'm just very proud of the organization and how we've been able to navigate it to this point, staying true to the fidelity of our mission. Like Sister said, we don't make decisions without looking through the lens of our mission, and that was once again an incredible tool for us as we navigated the last several years.
Taking things up a notch or so, what do you both see as the biggest challenge facing healthcare in the 21st century?
Well, I think we're in the midst of it. We're trying to be more than just more than sick care. We want to be in the business of healing our community, making the whole community healthier, more just, actually, and more unified. And I think that, the stage of Baltimore City is a great place to see the need for that. And we're pleased to have a role in it. So I don't know if it's the challenge of the 21st century, but it certainly is the challenge at hand. And it's challenging enough, right?
During the last 2 years, I think we saw challenges with access. We saw some serious inequities that gave the whole nation pause, and rightfully so. You know, here at Mercy's, our values speak to that. They speak to justice. They speak to dignity. They speak to all of those issues. So I think raising the bar in respect to access, equity, equality, and continuing to serve the community at the highest level is paramount. And that the story of healthcare has evolved over a time, and there are always challenges. But the challenge we face now is to continue to provide that access. And you know, right on our doors it says, regardless of race, creed, color, we treat everyone and anyone who comes through the door. That has been foundational to the Sisters of Mercy, and it just brings me enormous pride. And I think all of us who are part of the Mercy family to be part of it.
To take things down a little bit, when you're not leading Mercy into throughout the 21st century, what do you like to do for fun?
Well, I'm an addicted reader, so I do a lot of reading, and I also do a lot of crosswording. I like word games, and
You do the Wordle? We hear so much about Wordle now.
you know, I've looked at it a couple of times, but I haven't. No, I haven't taken that up yet. That'll be maybe a new challenge for me.
Dr. Maine, well, I have to jump in. Football. You're a fan of a particular team. Sister Helen, you're a fan of a particular team.
Yeah,
and
of
I don't think they're the same team.
Well, you know, I'm from upstate New York, and I'm an Oriole fan because of the Rochester Red Wings, and I'm a Buffalo Bills fan. I was since I was a young boy, and if measuring a father's success is, do your kids like the football team that you grew up, I've been successful. But yeah, I'm a big Bills fan, and it's been quite a ride, and excited for the year ahead. And Sister and I, you know, I'm the luckiest guy. I have an office right next to Sister, and so when it comes to sport, we certainly enjoy our little rivalry. And
He won last year, but we'll see.
See you
We'll
this year.
see.
All right. Okay. That's great. Sister Helen, Dr. Maine, I want to thank you both for your time and your candor. I'm hoping the viewers enjoyed this chance to hear your stories, learn about some important topics, and maybe something they can apply to their daily lives. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, may the road rise up to meet you. And welcome back again for our Wait, I Forgot to Ask segment. This is where we talk to physicians usually about what patients forget to ask and the doctors wish that they would ask. Well, this time it's the question I forgot to ask. And the question I'm going to ask our guests today, which are Dr. David Maine, Sister Helen Amos, do you think we'll ever see nationalized health care of some kind in the United States?
It's a tough question, Dan. You know, I think, look, these are discussions that have been ongoing for some time and continue. And we've come a long way since ACA in 2010. We've made tremendous strides. In my view, that maybe is the most important piece of legislation during my lifetime.
And that's the Affordable Care Act for people.
The Affordable Care Act, yes. And so as a country, we made huge strides in terms of access to health care for all the citizens of this country. Now, it's imperfect, and I think that is fairly well recognized. And I think these discussions about nationalized healthcare and how we prepare for healthcare delivery in the future will continue. The Medicare Trust, which finances Medicare, the largest payer in our country does not have an unlimited runway. I think projections right now are that it may run out in 2028, something like that. And so I think those discussions will continue to accelerate in terms of how do you deliver healthcare for the country in the future. And I'm not sure where it will go, but we'll continue to have discussions on it, I think, for sure. There's lots of benefits to national healthcare. There are certainly lots of examples that we can refer to. But there's lots of challenges as well, including physician shortages and ensuring timely access, which there are some challenges that occur in national healthcare systems. But I think it's a healthy discussion that we in healthcare delivery and those who work towards policy in the country should continue to have, so that we can take care of the people the way we want to. At Mercy, we take care of anyone who walks through our door. So we'll focus on just providing the highest quality care and compassionate care, and we'll let the rest play out.
I think the issue at hand is it's not really about nationalized healthcare. It's about just making sure that healthcare is available to everyone who needs it. And as you said, everyone who walks through our doors. Mercy lays out I've seen figures as high as $35 million in charitable care. So the care is going to be delivered. But ultimately, I think that's the work that needs to be done. What can we be doing on a national level to make sure healthcare is accessible to all citizens? What would you say, Sister?
Well, I would just say that as things continue to evolve, let's keep our eye on whatever the system is, who are the people for whom it's not working? And how can we help the system to evolve in a way that is accessible to more people?
Thank
Doing
you
it better.
Yes. Thank you both.